You sit on a stiff velvet chair in a narrow corridor that smells of carbolic soap and damp wool. A clock ticks like it's judging you. Somewhere behind a closed door, a man's voice is calm, too calm, speaking the language of science over sounds you can't name. Your palms sweat inside your gloves. You don't know what you're walking into, only that you've been told it will restore your nerves. Then the door opens. A woman rises, face pale, eyes unfocused, like she's just survived something private and enormous. She avoids your gaze. The nurse doesn't. The nurse simply gestures for you to enter. Inside, the doctor doesn't look like a villain. That's the strangest part. He looks like a professional, and he's about to perform a treatment that will leave you trembling, relieved, and silently ashamed, without being able to explain why. Before we go deeper, tell me where you're watching from. It still stuns me that these old, unsettling stories travel across the whole world through one screen. He is called Dr. Halstead in the neighborhood, a name spoken softly in drawing rooms and loudly in whispers. London, late 1800s, an empire polished on the outside, rotting with soot underneath. Horse hooves strike wet cobblestone. Gas lamps hiss in the fog. In the respectable districts, there are rules for everything. How long a widow must grieve, how a young lady must lower her eyes, how a wife must never admit to wanting anything at all. And in this world, medicine has its own faith. It is a faith in labels, in diagnoses that sound Latin enough to become law. It is a faith that women's bodies are not merely bodies, but mysteries, dangerous ones, liable to disturbance, excitability, derangement, and the most famous word of all, whispered as if it's a verdict carved into bone, hysteria. It will be written in medical notes with a neat hand. It will be spoken in consulting rooms like a prayer. And it will become the justification for a practice so surreal, so morally knotted, that even the people doing it can't admit what it resembles. Because here is the paradox that powered an entire era. Victorian doctors insisted respectable women did not feel sexual desire, while building a profitable medical ritual that depended on provoking the body's most unmistakable response. The first patient in our story is not a rebel, not an artist, not a scandal. She is, in the eyes of her society, the safest possible person. Mrs. Eleanor Ashford, 32, married, well-dressed, impeccably mannered. The kind of woman who writes thank you notes the same day she receives a gift. She comes to the clinic because she is unraveling. It begins with sleep, or rather, the absence of it. Hours staring into darkness while her husband breathes beside her like a man already forgiven by God. Then it becomes irritability, sharp words that jump out before she can stop them. Then a strange tightness in her chest during tea, as if her ribs have turned to iron. Sometimes, without warning, her hands shake. Not violently, just enough to betray her. Her mother calls it nerves. Her husband calls it fatigue. Her friends call it that time of the month, with an embarrassed laugh. But when Eleanor finally breaks, when she stands at a piano during a small gathering and suddenly feels heat flood her body, her pulse misfire, her breath turn shallow, her knees weaken as if the floor itself has tilted, her husband does not laugh. He escorts her out with the rigid gentleness of a man preserving reputation. And reputation, for a Victorian family, is more valuable than comfort. So he brings her to Dr. Halstead. The clinic is designed to reassure: heavy wood paneling, medical journals stacked like bricks, the sharp, clean scent of antiseptic. A framed diagram of the human body hangs on the wall. Male, of course, labeled in confident ink. Eleanor sits on the edge of a chair as if her posture might protect her. Dr. Halstead listens with the patience of someone collecting evidence. Insomnia, palpitations, irritability, a sense of dread, a pressure that comes and goes. Spells, she calls them, because she has no better word. He nods once, as if she has confirmed a theory he already owns. Hysteria, he says, not cruelly, clinically, almost kindly, as though he has handed her a map out of a forest. Eleanor does not know whether to feel relieved or condemned. He tells her it is common. He tells her it is treatable. He tells her it is, in some ways, the cost of being a woman of refinement, too sensitive, too delicate, too finely tuned for the brutal world. He does not tell her the truth that matters. Hysteria is not one illness. It is a net. It catches anything a woman feels that makes men uncomfortable. He asks her to step behind a screen and undress from the waist down. The request lands in Eleanor's mind like a dropped plate, loud, shocking, impossible to pretend she didn't hear. But the nurse is present, and the nurse's face is calm, and calmness is contagious. Eleanor obeys because obedience has been her lifelong language. When she lies back, a sheet is placed carefully across her abdomen. Not to cover her entirely, just enough to preserve the fiction that this is not intimate. The doctor's hands are warm. He applies oil with the brisk confidence of routine. There is no romance in his expression, no hunger, only focus. And that, strangely, makes it worse. Because if this isn't desire, then what is it? At first it feels like examination, pressure, movement, method. Eleanor clenches her jaw, eyes fixed on the ceiling. She hears the tiny click of instruments on a tray, the scratch of a pen as the doctor notes something. The nurse stands nearby like a witness to propriety. Then the sensation shifts. It becomes sharper, more specific, less like touch, and more like ignition. Eleanor's breath catches, her thighs tense. A sound escapes her that she tries to swallow. Heat swells low in her body, rising like a wave she cannot stop. Her mind searches for a name. There isn't one she can use. And then it happens. A sudden, involuntary cresting, muscles contracting, lungs pulling air in raggedly, a flash of relief so powerful it feels like violence. Her body arches. Her fingers grip the edge of the table. For a moment, she is nowhere but inside sensation. When it ends, she lies trembling, damp with sweat, ashamed in a way that does not match anything she has been taught about sickness. Dr. Halstead steps back and writes, "Excellent," he murmurs, as if he has tested a reflex. "A pronounced paroxysm. You should experience relief." Paroxysm, not pleasure, not climax, not orgasm. A medical word thick enough to smother meaning. He schedules her to return, twice weekly. Eleanor dresses with hands that won't quite steady. She walks out into the London street with her face composed and her body humming with a secret she cannot confess, even to herself. And that is the first cruelty of the system. It gives her relief while stealing her language. Because to speak plainly would be to become the thing Victorian society feared most, a woman who knows what she wants. The roots of this did not begin with Victoria. The obsession with female disorder is older, ancient, almost mythic. For centuries, physicians treated the uterus as if it were not an organ, but a creature. Some claimed it wandered through the body causing chaos. Others insisted it poisoned the mind with invisible fumes. And even as anatomy advanced, muscles mapped, nerves named, organs pinned in place, the old idea remained in spirit. Womanhood itself was a medical risk. By Eleanor's era, hysteria has become the perfect diagnosis because it is endlessly flexible. Too emotional, hysteria. Too quiet, hysteria. Too interested in sex, hysteria. Not interested enough, also hysteria. A headache, a fainting spell, a refusal to smile, an urge to cry, a sudden temper. Anything can be poured into the same container. And once it is labeled, it can be treated. This is where the moral contradiction becomes almost unbearable. Doctors can touch women in ways no respectable man is allowed to touch them, so long as they call it medicine. In the city, the treatment spreads like an unspoken ritual. Some women are sent by husbands desperate for quiet. Some come through mothers worried about marriage prospects. Some come alone, inventing symptoms because they have discovered, wordlessly, that the clinic offers something that life does not. And the doctors, many of them, believe they are doing good. They speak of nervous congestion and uterine excitability. They describe the goal as inducing a therapeutic crisis, a release that calms the system like a storm breaking. They note the physical signs in detached language, flushed skin, rapid breathing, muscular contractions, relaxation afterward. They are documenting orgasms without admitting it, sometimes without even understanding it, because female pleasure is not part of the respectable story of the body. Eleanor returns the next week, and then again, until the appointments begin shaping her calendar. She tells her husband she feels better because she does. She sleeps. She laughs at smaller things. Her chest feels lighter. But something else grows beside the relief. A strange hunger not for the doctor but for the moment. The wave, the quiet afterward, the feeling of being unclenched from the inside. She hates herself for it. Then she hates herself for hating herself. And then, slowly, she begins to realize she is not alone. In a friend's parlor, another woman mentions a certain physician in a tone too casual to be casual. At a dress fitting, a seamstress murmurs about those treatments, as if they're as common as laudanum. A maid, eyes lowered, says her mistress, goes to the doctor for her nerves every Thursday, and seems happier afterward, strangely radiant. A network forms under the surface of propriety. Recommendations, whispers, strategies. Which doctor is effective? Which clinic is discreet? Which nurse is kind? Which appointment times avoid gossip? And this becomes the second cruelty. The same society that denies women sexual agency quietly tolerates it, as long as authority controls it. But the doctors have a problem. It is not moral. It is not philosophical. It is physical. Their hands cramp, their wrists inflame, their forearms ache from repetition. Hours each day spent coaxing paroxysms from patient after patient, like a factory line of relief. Some physicians complain in professional circles, not about what the work implies, but about first, it is a machine with wires and batteries, heavy and humming. It is presented as a modern marvel, part of the electrified future. A device that can stimulate circulation, restore vitality, calm nerves. It can do in minutes what a doctor's hands do in an hour. The clinic becomes louder. A low mechanical buzz behind closed doors. A quicker appointment schedule. More women seen per day. More profit. Less strain. And the women? Some are frightened by the machine. Some are fascinated. Some feel an almost religious gratitude for the speed of relief, because the longer the procedure lasts, the more the mind has time to revolt against it. Eleanor tries it for the first time and thinks briefly of lightning, how it strikes without caring what it hits. Afterward, she sits up slowly, hair damp at her temples, heart pounding. The doctor is already washing his hands as if he has treated a sprained ankle. She wants to ask, "What was that?" But she doesn't, because she already knows, in her bones, that the question itself is dangerous. At home, her husband notices her improved mood and congratulates the doctor's skill. He does not ask what the treatment involves. He does not want to know. Knowing would change the shape of his world. This is how the entire system survives, not through ignorance alone, but through willful avoidance. And then comes the third cruelty, perhaps the darkest, the double standard. A woman receiving therapeutic stimulation under a doctor's supervision is considered healed. A woman seeking similar relief alone is considered depraved. Doctors warn about self-abuse with moral panic. Some even recommend brutal interventions to prevent it, while simultaneously performing the sanctioned version behind clinical curtains. The same act is purified or condemned, depending on who holds the authority. Eleanor hears rumors of women punished for desire. Girls watched too closely. Hands slapped away from their own bodies, shame used like a leash. She reads advice pamphlets that speak of female virtue as if it is a fragile glass that can shatter from the wrong sensation, and yet she also keeps returning to the clinic. Because relief is not theoretical. It is real. Her spells vanish for days after each appointment. The tightness in her chest loosens. The irritability fades. She begins to feel, for the first time in years, like her mind belongs to her again. The paradox hardens into something almost heartbreaking. A system built to control women accidentally gives them comfort. But comfort is not freedom. In the waiting room, Eleanor begins to recognize faces. Women of her class, women older than her, women younger. Some sit rigid with embarrassment. Others sit with a strange, quiet anticipation they would deny if accused. Once, she sees a woman cry after her appointment, not from pain, but from something like grief. Another time, a woman laughs breathlessly as she leaves, cheeks flushed, eyes bright, and then composes herself the moment she steps into the street like closing a door. Eleanor wonders what happens to them all when they go home. How they explain the lightness in their step. How they carry the secret under corsets and conversation. Then history shifts, as it always does. Not with an announcement, but with a slow change in what society can pretend not to see. New ideas creep into medicine. Some doctors begin talking about the mind, about trauma, about repression, about emotions that manifest as physical symptoms. Hysteria starts to fracture as a diagnosis, not because people suddenly respect women, but because the category becomes too messy to defend as science. And then, from a place no respectable person wants to credit, the final blow arrives. Images begin to circulate, moving images, underground films that show vibrators used openly, sexually, without medical pretense. The device that had lived in catalogs and clinics is suddenly unmistakable. Once society sees it without the white coat, it cannot unsee it. And that is how the medical world retreats. Not gradually, suddenly. Advertisements vanish, clinics quietly change methods. Devices disappear from respectable shelves as if erased. Doctors stop offering the treatment, not because they have admitted the truth, but because the truth has become too visible to hide inside Latin words. Eleanor's last appointment comes without ceremony. Dr. Halstead clears his throat, avoids her eyes, says he is moving toward more modern approaches. He recommends rest, fresh air, perhaps travel. He writes a prescription that feels like an apology he won't speak. Eleanor stands, dressed, confused. She wants to ask why. She wants to demand what has changed, but she already knows. The world has shifted just enough that the old lie can't hold. And now she must go back to living inside the cage of silence, with the additional burden of having tasted something the cage was built to deny. Years later, long after the clinic's door has closed, there will still be traces. A ledger tucked in an archive. Names, dates, payments, repeated appointments stretching across decades. A medical note describing paroxysms in clinical handwriting, accidentally poetic in its precision. A dusty device in a museum case, described politely as a therapeutic instrument, while visitors smirk because modern language makes it impossible not to. But the most haunting artifact is not paper or metal. It is memory. Eleanor will remember that corridor smell of antiseptic and velvet. She will remember the clock ticking like judgment. She will remember walking into a room where authority touched her body and called it healing. She will remember how quickly society stopped pretending, how fast the treatment became shameful once people admitted what it resembled. And she will remember the strangest contradiction of all, that the same culture that denied women desire found a way to sell them relief, provided it could be controlled, renamed, and kept behind closed doors. They remembered. They recorded. They could not look away, yet they could not say the word. And if you want the final image to linger, let it be this: a London street at dusk, gas lamps flickering, carriages rolling past, Eleanor stepping out of a clinic door, adjusting her gloves, face composed like a painting, while inside her something private still echoes. Not sickness, not sin. Just a human body, insisting on being real, even when history refuses to speak its name.